and welcome to another episode of In the Studio. The program is brought to you by Davis Media Access as a service to our community to educate, inform, and entertain. It broadcasts on Davis Community Television, that's Comcast Channel 15, and AT&T UVerse Menu 99. It's also online at dctv.davismedia.org and on YouTube. And the program is also downloadable, free. I'm Lynn Weaver, and I'm going to be your host. And joining me today to talk about diabetes is Bridget Levick, a director of the UC Davis Department of Health and Education, as well as Christina McCoy. She's the senior representative for the community education, I believe, and community education, I believe, yes. Welcome both. Thank you so much for taking the time to be on our program today. November is Diabetes Awareness Month, and we're all very keen on learning more about this disease. This disease is more and more in the news because of its increasing incidence in our population, both human and animal population. So welcome again, and let's dive in, and I'm going to ask Bridget the first question. Why are overweight people more at risk of getting diabetes?
Thank you, Lynn. It's great for us to be here to be able to talk about our program, and diabetes is an epidemic, so we are especially looking forward to shining a big light on it this month. Overweight people are more at risk for diabetes, and it is largely because people that are overweight typically can be less sensitive to their own insulin. So it's really not a matter of patients with that are obese having less insulin. In fact, often they will have more insulin, but the problem,
interesting, yes.
The problem is that they aren't able to, their bodies aren't able to recognize and use their insulin as a person without diabetes would.
That's very interesting, and it is a very complex metabolic disease, and so sometimes it's difficult to understand, especially for the lay people.
Of course.
Yes. Now, we often hear in the news about the various types of diabetes within different types of seriousness. There's type 1, type 2,
correct.
Maybe there's a 3 as well. And can you, in lay terms, perhaps let us know, explain what is the difference between type 1, 2, and 3, starting which one is more serious than the other?
Certainly. So type 1 diabetes is actually much less common in our population than type 2. People with diabetes, only about 5% of those people have type 1. Although it does present in a more acute manner, people are more sick, and they're typically younger when they're diagnosed. The person with type 1 diabetes has no insulin, so they are completely insulin dependent. In fact, we used to call type 1 insulin dependent.
Yes, yes, I've heard the term, yes.
Type 2, on the other hand, is much more common. I'd say 90 to 95% of people with diabetes have type 2. Very common. It comes on very slowly and gradually, so it might not be recognized as quickly as type 1. And type 2 is, the patient is treated very often. We start with behavior modification or simply using lifestyle change with type 2, looking at nutrition choices, trying to increase activity. They may end up on medication, but type 1, by contrast, goes immediately to insulin and will be insulin requiring for the duration.
That's very, very interesting. And by the way, Bridget, I forgot to mention when I introduced you that you are a certified
Diabetes educator. Right.
Yes. So you are really contributing a lot to our understanding. And of course, type 2 then is the type of diabetes that we hear the most in the press, because people are sedentary, they are obese, they are, not all of them, but they are the ones at maximum risk of getting the disease. So when you said modification in lifestyle, you obviously mean diet, exercise, and perhaps stress has something to do with it, maybe?
You know, stress can be another variable with type 2 diabetes, and a lot of times it's hard to differentiate between all of those different variables.
Yes.
So nutrition, activity, stress, those are all sort of very
interrelated,
often. Exactly.
Yes, and therefore more difficult to detect, segregate and detect and, and cure. You mentioned type 1 diabetes is rarer, and it affects younger people. Would you say that this is a genetic disease? Because basically there is no production of insulin in those people. And when does it manifest itself?
Right. So this is a complex question, and there's lots of research being done on genetics and both type 1 and type 2 diabetes. Typically, we know there's a very big connection with the genetic link to type 2 diabetes. So in other words, if someone has a lot of family members that have type 2 diabetes, they are more at risk for developing type 2 diabetes. It doesn't necessarily mean they absolutely will. Just like the same thing you could say is that people with no genetic link to type 2 diabetes could develop type 2.
Type 2, yes.
Right. There is some research also around type 1, and so that's also a factor. But I think because mostly when we talk about our epidemic, we are concerning ourselves with type 2. So I like to sort of think about that as a registered nurse and dealing with patients. You want to know that patients that you're teaching with diabetes, you also want to encourage them to make any kind of lifestyle changes in their family, because their family may already be at risk as well.
Yes. So just to recap in my mind, type 1 diabetes has always existed, and it is more of a real disease that I don't mean real disease, but it's something that so far we don't know how it works in the body. We only know that the body does not produce insulin, whereas diabetes, and correct me if I'm wrong, and diabetes type 2 is more of the factor of a lifestyle, is more a factor that comes into it. So hence this growing, increasing epidemics. As I said, it is a very complex, yes. So insulin balances the sugar in the blood stream.
Yes.
So if you never eat sweets in your life, does it matter?
No. That would be way too simple. And so let me back up to just clarify one thing. With type 1 diabetes, we do know that it is, we know what happens and why people develop type 1. It's largely an autoimmune disease.
Yes.
Or virus can be a factor. And I wanted to be clear that although people are usually diagnosed younger. We do also see diabetes in later years that is type 1 as well. But if you were to draw a line, it's usually younger and thin people that are more likely to develop type 1.
Yes.
So to address your other question, no, it's not as simple as that. And I love that you said that, because that's a myth.
Yes.
That a lot of people think, if only I could stop eating sugar,
Yes.
my diabetes would go away.
Yes.
But the reality is that anything that is a carbohydrate turns into
glucose. Yes.
So it could be a piece of bread, it could be an orange, it could be a glass of juice, it could be
Pizza.
Pizza is carb and fat, but anything that is carbohydrate turns into sugar. So when you were when you said about insulin and glucose, anything that is a carbohydrate turns into glucose, and insulin acts as a key to get the glucose out of the blood, where in excess it makes people sick.
Yes.
Gets out of the blood and into the cell to provide energy to the body. That's
what a fabulous, fascinating, yes. And of course, insulin is a protein, right? It's very interesting to what you mentioned, Bridget, about the autoimmune disease, which means, and the factor of a virus or a viral infection that would lower your immune reaction to this, because this offers an even more complex dimension to diabetes.
Correct.
So it's like all the autoimmune research. This is extremely complex, so that makes it difficult. But we are talking here not so much about research, but about educating people on what disease is, and also finding ways to have people access facilities or clinics to where they can be tested and advised on what to do.
Right.
And I like to keep the focus on this, because research is too vast a topic, and our community really needs to know more about where to get help.
Exactly
basically.
right.
So I'm going to ask Christina about the UC Davis Health Management and Education Department. I believe you are more in tune of what happens day to day in the department. Can you tell us a little more about it, and how long you've been working there, and why did you choose to become part of this department? I want to know a little more about you, in other words.
So I've worked for the UC Davis Health System for about 13 years, and in the last 4 years I've been privileged to work with health management and education. So what our department does is we teach chronic disease patient education classes to our patients and our health system employees and retirees. So we have registered nurses, registered dietitians, as well as health educators who teach our programs. Most classes are 2 hours in length, but some are part of a series and they last a little bit longer. So patients will come in once a week for 2 hours for a course of maybe 8 to 12 weeks. We teach about diabetes, weight management, heart disease, including blood pressure and cholesterol.
Yes.
We teach about smoking cessation, stress management, chronic pain, asthma and lung health. And most of our classes are free for patients.
Yes. And of course, you're based in Sacramento.
We are based in Sacramento, but we do take our show on the road.
This is what I wanted to know. And by the way, in a moment, hopefully we'll have the URL, the website link displayed on our screen, so that you can go to the website and find out more about all these educational initiatives that you have, which is great. Sorry for interrupting.
Oh, no problem. So we teach our classes at most of our classes, we teach the topic at least several times a month.
Yes.
And then we travel out to the different UC Davis clinic offices, and we teach at their various locations. So if a patient of the health system or an employee would like to look at our website, they can see our schedule of classes.
Yes.
For those who aren't employees or patients of the health system, we do have lots of information that you can read on our website.
Yes.
That's trusted information that's coming from the health system. There's videos that patients can watch. And right now for the month of November on our homepage, we have the diabetes risk test. It takes about maybe a minute, and you can know your risk factors for diabetes, and then you can take action with your primary care provider to find out if indeed you really do.
Well, this is, let me stop you there for a moment. First of all, this is the diabetes, November is Diabetes Awareness Month, and in a moment you're going to tell us a little bit about the fair that is coming up in a few days. Unfortunately, by the time this episode of In the Studio broadcast, it will have happened. However, you can tell us a little bit about what services and what you're planning to do at the fair.
Great.
Because hopefully next year there'll be another one. But I stop you right there about the test that you just mentioned. Can you give us a little more details about this 5 minutes, did you say?
No, it just takes a minute.
Oh, a minute?
Yeah.
And what do? Do you prick people or
no? It asks you several questions about your age and your weight and your family history, and it gives you a better understanding if you are at risk for diabetes. It's interactive. You just hit the link on our webpage, or even if you just do a search for diabetes risk test, you could find it. You don't have to go on our website, but we'd like if you did. But it takes about a minute. Just asks you several questions, and then it gives you your risk factor.
I see. And once you know these risk factors, and assuming that they are pretty high, where can you get free testing for diabetes? I say free because a lot of people still don't have health insurance. So this is our tragedy at the moment in this country. Do you know, and you may not know off the top of your head, if there are clinics that offer this test?
I don't know about individual clinics, but I do know that probably reaching out to the American Diabetes Association, they may be able to link you up with some maybe student health clinics or community health clinics that may provide free testing.
That's already a good thing. So the American Diabetes Association website would be a good starting point.
Yeah.
When you say you take the show on the road, do you also go to Davis?
We do have a UC Davis clinic in Davis.
Yes,
and
surprisingly.
Most of our education done at the Davis clinic is done individually with our nurses and our dietitians.
Yes, so you don't have workshops, but you just...
We have a limited amount of workshops out in the Davis area because the majority of our patient population is centered in Sacramento.
Yes.
But we do offer individual education on a regular basis at our Davis clinic.
Before we go on to the services that you'll be offering at this health diabetes fair, could you tell me about you're part of UC Davis, the University of California, Davis. Do you receive funds from the federal government, or is it private? Yeah, probably.
I will let our director answer that question.
Yes, we're very lucky in health management and education to be supported by our health system.
Yes.
This is seen as a really important proactive step to help the patients at UC Davis stay well and stay out of the hospital. We know that the work that is done in preventing complications of diabetes or even promoting wellness for patients with diabetes is going to work well for our population. So the community support is out of our leadership.
Yes.
Leadership provides support for our health system program, and so we've been so that's it. We are funded by UC Davis. We don't.
So you have a great deal of support.
Correct.
From the medical center,
Yes.
or rather the health services. Yes.
Even to, oh, sorry.
Sorry, no.
Even to the degree that our smoking cessation program, which is very unique, that would be a free program, is a free program for UC Davis patients, and it's a multiple week program that is facilitated by a Mayo Clinic trained tobacco cessation specialist. So the fact that patients can come in and avail themselves of that is a really big bonus.
Well, that's wonderful. Now let's get to the fair. Sure. I'm sure you're very, very busy trying to get this this fair organized. So so let's have visualize a scenario. People come, and what services can they benefit from? Education, pamphlets, information, literature, that's the obvious things. The less obvious things, what would it be?
So UC Davis Health System has partnered with the American Diabetes Association to provide this diabetes health and wellness fair. So we will have, patients will have the opportunity, or the community will have the opportunity to ask questions to a registered dietitian, a registered nurse, as well as a pharmacist. And our smoking cessation tobacco treatment specialist will be on hand to offer information and advice to patients who want to quit tobacco. We will have blood pressure and blood sugar screenings for those
and
individuals.
And cholesterol too?
We won't be performing that day,
No.
but blood pressure and blood sugar screenings will be available for those individuals who like to participate. We'll be talking about our health education classes, as well as numerous patient education pamphlets, and information will be available for individuals to take home. The American Diabetes Association will also be available and on site to offer more information about their program, as well as to link individuals to the community providers and education that's available so they can learn more about diabetes.
Well, it sounds wonderful, and I'm, again, hopefully our viewers will be able to benefit next year.
Right.
You have it yearly, during November.
Correct. This is the biggest diabetes health fair we've done thus far, but we're very confident that it's going to go well, and we're looking forward to doing it every year. It's a great opportunity, and it's not only for UC Davis patients, but for all community members.
All communities, and
Correct.
of course these days everything is online.
Correct.
And videos, you mentioned videos, as well as information. So there is no longer any excuse for being naive about this disease or other things. And even though a lot of people still are not do not have access to online information, and thus having a fair is even more important. Now, let's switch to something else. Two things.
Okay.
And I'm going to ask Bridget.
Okay.
Can people die of diabetes?
People can die of complications from diabetes. Such as kidney failure, cardiovascular disease, all of any organ that all of the organs of a person with type 2 diabetes are affected by elevated blood sugars. So you can talk about any organ that is going to be compromised by ongoing poorly controlled diabetes could be a reason for end-stage problems.
And this is akin to high cholesterol consequences, and also high blood pressure that damages the organs. Yes.
It's also very interesting that diabetes is rarely the only diagnosis that a person with type 2 diabetes has.
Yes.
They almost always have other chronic illnesses, typically, as you just said, hypertension and hyperlipidemia or high cholesterol. So, interestingly, any of the changes in lifestyle benefit all three of those. So if a person with any one of those three diagnoses chose to become more active, and I mean just any increase in activity
Yes.
is going to benefit that person
Yes.
in all three of those diagnoses.
Yes, and especially children, because I understand there's an epidemic
Yes.
of obese children
Yes.
or children who have poor lifestyle. They're not necessarily obese, but they
Right.
just have inactive lifestyle, could develop this disease, which is dreadful. And the other question, and I'm going to ask Christina, but jump in.
Sure, I will.
What are the symptoms of diabetes? I could have diabetes. Anyone could have that and not know about it.
I'm gonna let you handle that.
So although
I know them, but I
I'm
don't want to give
confident-
bad information.
I'm confident she could take that, but I'll happily share. So the typical symptoms of diabetes are the symptoms of high blood sugar.
Yes.
So those are frequent urination,
Yes.
great increased thirst, tight fatigue, inability to heal. So if someone had just a
bruise
small
or a
wound
cut.
that wasn't
Yes.
healing,
Yes.
that might be a sign of problem with
But it could
blood
also be a
sugar.
sign of lots of other things.
Of course it could. And,
Yes.
and so what we say is that if people have, especially the great increased thirst and urination, and it's not just a little increase, it's like you
Noticeable.
notice it. Yeah, you're getting
Noticeable.
up multiple times at night
Yes.
because you're so thirsty and you have to go to the bathroom again. Those are worth going to your primary care provider and just checking it out. Or as Christina said, taking the risk test, and if you have
Yes.
any of those symptoms, then
Follow up
Correct.
with a physician.
Right.
Yeah.
Well, ladies, I'm afraid our time is up. It went very quickly, but I am so grateful for having you here today to explain a little more and educate us on the disease. I know how busy you are, so I'm particularly grateful, and I'm particularly grateful on behalf of the community about all the wonderful work you do. So I wish you the best of luck with the fair,
Thank you.
and the best of luck with the expansion of this outreach to make us be more aware of the disease. And thank you, all of you, for watching. You can, of course, stream this episode after it broadcasts, and as I said, you can also download it free of charge. You might want to log on to our website at dctv.davismedia.org, and if you want, also take a look at some of our other interesting programs that Davis Media Access offers to the community. So from all of us here at Davis Media, thank you so much for watching, and see you next time.
Thank you, Lynn.